Statistics show that 70 to 80% of cardiac arrest cases occur either in a person's home or in public places. In such cases, the person nearest the victim is often a bystander, such as a relative, a colleague, or a passerby. If those bystanders present at the scene are able to provide CPR to the victim promptly, the victim's chances of survival are significantly increased. This is because time is the essence when treating a cardiac arrest victim. Once their heart stops beating and blood stops flowing, a person will lose consciousness within 15 seconds. Within another 30 to 60 seconds, the victim will stop breathing, and irreversible damage to the brain cells will follow after several minutes of being deprived of oxygen. These statistics show that CPR saves lives. In this video, I will demonstrate how to perform CPR effectively. Step 1. Assess the scene. Make sure the scene is safe. Make sure there are no safety hazards, chemical spills, electrical wires, gas, fumes, or anything that could be considered dangerous. You cannot help anyone if you become a victim too. If the scene is safe, check to see if the victim is okay. Look for a response. If you don't get a response, yell for help or call 911. Check the victim for breathing or gasping. Scan the victim's body from head to abdomen for 5 to 10 seconds, looking for a sign of a chest rise or fall. Check for agonal breathing. It sounds like gurgling or gasping, but it is not breathing. If this occurs, you must start CPR as soon as possible. Check for a carotid pulse with 2 fingers on the center of the neck. If they have a pulse but are not breathing, give a rescue breath every 5 seconds and recheck their pulse every 2 minutes. To give a rescue breath, tilt the victim's forehead back and lift the victim's chin. Pinch the victim's nose and cover the victim's mouth with your mouth. While doing this, look for a chest rise and fall. If no pulse is present, do a cycle of 30 compressions and 2 breaths until help arrives. You should remove the victim's shirt, draw a line from armpit to center of chest for hand placement, place heel of hand on lower half of sternum, place other hand over the first hand, interlacing your fingers for support. Keep your arms straight and your shoulders over the victim's chest. Push down on the victim's chest. You should do it fast, as you want to give at least 100 compressions in a minute.